question that I get a lot is, hey doc, should I see a chiropractor or should I see a physical therapist? And inevitably, the answer is a lot of times both. So let's say it's something that happened over the course of time because of bad postures, positions, activities. A lot of times, number one, we need to address the chronic joint dysfunction. When joints are not moving through their natural range as often as every day, then what happens is you get an accumulation of scar tissue. You also get joint restriction as well as the soft tissue spasticities, right? You get those tight muscles, etc. So a lot of times if you're only doing massage or you're only doing physical therapy or you're only doing chiropractic, you're only going to get part of the result. The power is in combining the three, because then you're addressing getting the joints moving correctly once again through gentle, specific, and natural chiropractic care. I tend to teach a lot of my patients how to do their own mobility with a lot of the tools that I use here. I really enjoy using the AccuMobility tools because patients can get those inexpensive tools to use on their own to help deliver some of their own soft tissue releases. And number two, they get instruction on how to do the corrective exercise to enable them to strengthen the ligaments, the tendons, and the muscles that allow those joints to function properly. A lot of times there's power in having a professional do soft tissue release for you, and I love physical therapists and massage therapists for that. Every problem is different, but I find the combination of the powers of chiropractic and physical therapy work awesome together.